Globally, there are 93 million children with disabilities between the ages of 0 and 14. What is critical are the first 3 years of a child's life, so we talk about the first 1,000 days. There are critical periods of brain development, and these can provide essential building blocks for future growth, development and progress. What is important for children with disability is to receive timely, appropriate intervention and services in order to reduce the possible onset of disability or developmental delay. So, for example, a child with a visual impairment, it's important to build on their existing vision by using different mediums to develop their skills. We also need to provide opportunities for children with disabilities to participate in optimal development. So when we take a child from a home setting to a play setting, it's important that children have the opportunities to interact with other children through peer interaction. It's absolutely essential that children with disabilities have the opportunities to form friendships and be able to play. This is not always easy for parents who may find it difficult to take their child out of the home as a result of many problems. For example, the lack of support in the home setting, or the lack of encouragement from schools to take their children to these places. It's absolutely essential that all children within the first 1,000 days of their life receive essential screening for developmental delays and disabilities. Unfortunately, many children with disabilities may not be able to access these recommended screenings. So, for example, the American Pediatric Association recommends screening for 9, 18, 24 or 30 months. What's really important is for children who are preterm, low birth weight or any other reasons for concern, that these children receive regular screening. What happens is that some parents with children with disabilities do not know about the screening services that are available, or they are unable to take their children to the right doctor or to the clinic because of lack of knowledge or even ability to transport their children to these clinics. Therefore, these children miss out on essential screening opportunities. Research shows parents do experience a lot of depression, high rates of depression. They can also suffer from what's called distress-related illnesses as a result of stigma and misconceptions about disability, both within their community and within the wider district that they live in. So, for example, a parent who has a child with albinism may actually have difficulty in introducing the child, given the fact that the child looks different and that there may be some stigma about the family being sinful or having a wrongdoing. Another example is that parents of children with disabilities experience greater isolation, and this can often lead to them having to stay at home and being the sole guardian or keeper of the child. This therefore has an impact on the opportunities for employment, education and socialising. And this can then relate to difficulties in gaining income and leading to extreme poverty. There's also the risk of marital breakdown in divorce. So many families experience a lot of stress as a child with a disability requires greater help and support, and this puts extra pressure on parents. What's strongly recommended are inclusive early childhood development programs for children with disabilities. And as a result of this push towards inclusive programs, a number of international initiatives have been developed. One of the most prominent ones is the UN Sustainable Development Goal, particularly Goal 4, which puts early childhood development as a priority focus for 2030. The main message is around ensuring no child is left behind. And in particular, all boys and girls have access to quality early childhood development care and pre-primary education. So we're talking about the ages between 0 and 8. And for children with disabilities, we also need to look beyond the age of 8, because many children with disabilities may not be called school ready. Another important legislation which is specifically aimed at people with disabilities is the UN Convention for Rights of People with Disabilities. Article 3, for example, looks at respecting the capacities of children with disabilities and respecting their right to education and to the same services as their non-disabled peers. And what's really key is to preserve their identities and not look at changing them. Another really important initiative, and a lot of groundwork has been done by the WHO and UNICEF, is from shifting from survival, childhood survival, to inclusive education childhood development strategies to enable these children to thrive and develop healthily. Stakeholders working in ECD really require good quality, robust data that is comparable between country to country. So recent research done by WHO and the Washington Group questions have come up with a number of tools. One of them is the Model Disability Survey, which is being tested across a number of countries, and it looks at child functioning. The other is the Washington Group questions, which again look at functioning, and they provide essential information on childhood disability. What is really useful about the Washington Group questions is that they can be integrated into a national survey or a household survey. They can use those questions, up to 14 questions, which can be used in any particular census. All good quality data should be used by these stakeholders in advocacy, policy formulation, planning of services, and stakeholders should be aware of these tools. They really need to implement them into their programs. An example of a really useful tool for identifying children with disabilities in low-income resources is the Key Informant method. This particular method has been used in Malawi and Bangladesh and has been very successful in identifying and later referring children with disabilities. It's particularly good because it's cost effective. Its methodology is around training volunteers in villages to identify children, many with moderate to severe disabilities. So we're looking at children with severe physical, sensory impairments and epilepsy. This has been successfully used in South Africa as part of a project called the Hambisela, where they have identified a high number of children with cerebral palsy who have later been referred to intervention services. Well, we need to look at primarily three key sectors. So, for example, health is really critical in the first 2 years of a child's life, but also later on as we need to follow the child's trajectory, learning and health trajectory. We need to ensure that children with disabilities or developmental delay receive regular screening. Not only that, they need to have follow-up and referrals to appropriate services. These services could be quite limited in low resource areas. It's therefore important that parents are given the right advice so that they know where to take their child. Their child may need to go to a main hospital for an important operation, or they may require rehabilitation services more locally. What's essential is that health services work very closely with families. It's also important to provide training to parents. It's really critical that parents know what to do when they are at home with the child. And this can be provided through training of parents and also of lay volunteer who can support parents in the community. Evidence shows that training parents on a regular basis really helps children with disabilities. It's also seen as important because of the lack of skilled professional health professionals. We need to look at training paraprofessionals or volunteers or community-based rehabilitation officers to support parents at home. Secondly, we need to look at education of children with disabilities. This can be in two parts. First of all, young children between the ages of 3 to 5 may enter what's called an early childhood development centre. The older children, 6 upwards, would go to a pre-primary school or a normal primary school. What's really essential are that the links between the home of the child with disability and the parents and the school are developed way before the child starts school. We often talk about school readiness and preparing children for school. What is essential is that schools understand the needs of children with disabilities. They need to make sure that their environments are adaptable and are ready for school, ready for children with disabilities. We also need to look at the curriculum and look at how children with disabilities require those special skills or additional skills so that they can function at home and in other places. We also need to think in terms of school readiness, that children who may not be considered as school ready because they have a particular difficulty in toileting or transitioning from one place to the other, that schools take this into consideration and make the required adaptations to their school. What's very difficult for parents when they take their children to school, if they are told that their child is not school ready, but they are of the statutory age. So it's really important that schools work closely with parents and also bring in specialised outreach officers who know the families well to discuss a child's learning trajectory, what they require in terms of adaptive curriculum, assistive devices, and anything else they require to make sure that they participate and integrate into the school very well. Thirdly, we need to consider social welfare. This is a department that bridges health and education together. What we need to think about are the development programs at community level that can support families of children with disabilities. In low-income resource places, it can be really difficult to find the right support at the right time. We therefore need to look at what's available within a community. Social welfare community development officers, for example, can provide that essential support to families. They can also make sure that the child is protected against any abuse that might or may occur. It's really important to think about the mental health of the carers too, and often they need to provide that bridge between other members of the community. As I said earlier, there can be great stigma and prejudice against families who have babies with disability. It's really important to make sure that parents feel supported and can go out into the community and rely on other members of that community to help and support their children. It's also really important to draw on what's called disabled persons organisations, or DPOs. Their role is really to support parents and also look at parent support groups, because parents really learn from each other about disability and how other children are being supported if they can get together, if there are opportunities to work together and discuss the difficulties they face. So to sum up, it's really important that we identify disability or developmental delay as early as possible. We also need to make sure that we have appropriate and timely intervention for children who have a disability. It's really critical that we work within that particular time limit or those windows of opportunity that I spoke about in order to help reduce the impact of disability or developmental delay on children and the onset or the difficulties families have in supporting that child. What is really key is that we should involve parents at all levels. Parents should always know about what's going on and be involved in key decision making. And what's really lastly important is that we promote equity-based approaches to ECD.